Edo State Governor Godwin Obaseki don tok say healthcare matter for Naija no be only for government, as private sectors need to join body with dem. Di governor tok dis one wen e do one tok-tok session with di Nigerian Medical Association for John Odige Oyegu Public Service Academy for Benin City. Edo State Chairman Nigerian Medical Association Dr. Udoka Imosili come throw a salute to di governor and say body sweet am wella for di work wey e don do for health matter for di state, but say dem need to improve for many things like di building and welfare, and say make governor help dem pass di bill wey go stop tori house wey dey play advert wey no pass through di association, so dat quack healthcare worker go reduce for di state, and say for di aspect of promotion some of dem never get since 2018.
Just as the popular saying goes, health is wealth. However, sir, the healthcare system in Nigeria has been inundated with significant challenges over the years, which has led to calls for advocacy and for health reforms. Part of the reason we are here this morning. One of the biggest issues facing the health sector is actually the brain drain, infrastructural, logistic challenges, and not just international brain drain, but we've noticed that interstate brain drain, the push and the pull factor. Some leaving the states, others coming. Your Excellency, 250 staffs were employed. And we went back to look at the statistics. We are still dancing around the same figure because some are leaving, some are coming, we're employing. And that's why we are here to appeal. In 2050, the goal of this state is to make Edo State a state where everyone wants to come and stay and prosper. And so we are appealing that Edo State should be a state where all doctors will want to come stay and come prosper. Edo State has been known to be the trailblazer. We are always in the forefront since you came in, sir, giving examples for other states to follow. And we believe this time around we would give them the light for us to follow. On this background, sir, I want to present the challenges facing the various government facilities and doctors in the state. So the poor state of secondary healthcare facilities, where we want to begin from. Why we are actually pushing for increased pay, increased economy, primary and the priority in our hearts is the state of the secondary health facilities, sir. I am aware that the primary healthcare facility is actually the gateway to health. But I once asked my doctors, imagine you go through a very beautiful gate to go into a house, and you get there, it's all full of grasses, the roofs are down. How do you, sir, we must appreciate all you've been doing at the primary healthcare centers, but they must go pari passu. I recall with so much pain a patient who was referred to my center late midnight Saturday from a primary health center. Of course, they were told, go to a private center. They believed, the woman said, no, I trust the government hospitals, and that's where I will go. Getting there on Saturday, midnight, no doctor. Pre-eclampsia, before she could get a vehicle to get to the nearest center, which of course, she has convulsed severally, and that was a very avoidable morbidity and mortality. So, sir, we are appealing. Still on the challenges with the private practitioners, use of non-medical professionals for inspection of hospitals, unrestrained practice of quacks. Sir, the quacks actually are quacking everywhere. You will just open your TV, you will just see one Mrs. Iyabo, and then she's telling you how she can cure from A to Z, even do the impossible. And then the unsuspecting public actually carried away. We're going to try to suggest a solution to that. On the streets, in the buses, you can't sit down in a bus without having them come into the bus and be telling you there's this drug that will cure stroke for you. The renal disease that would have been prevented goes on to renal failure. The hypertension that wouldn't have led to cardiovascular disease goes on because these patients actually believe the quacks. They talk with so much confidence and so much courage that rather than go to the hospital, they will listen to them because we have actually given them unrestrained environment to practice. Then the taxation of our call due to allowance, delay promotion, and then the almost loss of our residency training. The short-term solutions we are asking for to make sure that doctors and health workers don't move out of the state but remain hazard allowance, payment of the medical training fund, and promotion of stagnated doctors. If you as a worker, you don't know when your promotion is coming, you don't know what you are really getting, that actually doesn't bring motivation. We want to know when we are due for promotion, let's be promoted. Since 2018, sir, some of our doctors in AAU and in the states have not been promoted. I wouldn't want to bore you, sir, and then we're asking for digitalization of our facilities. That will improve patient satisfaction too, and improve our service and efficiency.
Governor Obaseki, will be ogbonge guest for the meeting, come talk say the government is committed to ensure healthcare system wey go deliver quality, efficient and affordable healthcare services to Edo people, and say they need support from all stakeholders to join body with them to help sustain reforms for the health sector wey dey in line with in government's vision. Governor Obaseki say when they enter office for 2016, they meet many problems, but they don't solve the problems small, as they no go fit solve all the problems of healthcare for 8 years. Say now make them as government sit down 6 years ago to rethink the healthcare services, wey go come stand on 4 pillars, and say in role as governor now to regulate the healthcare industry, as government not be the largest provider again, and say the second role now to train, support and produce quality manpower for healthcare industry, and the third na healthcare financing, as many people they find them difficult to pay for healthcare services. Now make them introduce Edo healthcare scheme, and everybody wey dey under the scheme they enjoy better healthcare. A constituent say consultant for health sector, they even receive salary wey pass im own wey be governor officially, and say Edo State go always be healthcare hub for Nigeria.
My experience in government so far, it seems to suggest that we are not hearing each other, we are not communicating. And I believe that what we should try and do is try and begin to understand each other. Let's try and be on the same, use the same hymn book, even if we're not on the same hymn page. But let's just, because today we are not. And it's not surprising that we are not, because as government, this has been our experience in the last 6-7 years, since we have been in government. We have, as a people, gone through so many changes over the last few generations that things are so confused and so mixed up that if we all don't sit down and agree to reset button, things are only going to get worse for us. We came into office in 2016 and we're clear to say, look, what are our priorities? We are not pretending we cannot resolve all the issues we met in 8 years. But what we promised is that in this 8 years, we will set a new direction. We will start the change of making Edo what it used to be, great again, and then put a roadmap that when we leave, if people stick to that roadmap, in another 20, 30 years, we will get to where we ought to be. And we've looked across the entire spectrum of society, not just healthcare, but the entire spectrum, and said, okay, what exactly is wrong and how do we fix? What should be our priorities? We picked 6. First is rebuilding our institutions. Because without institutions, we cannot develop. Individuals will come and go, but the institutions must remain. So if you are not building the institution, you are not training the people to have a sense of ownership and a sense of direction, you're not going to go anywhere. So institutional development was key, rebuilding the civil service and all its structures. And that's what you see. We should look at healthcare as a system and ask ourselves, what should be the role of government in our healthcare system? When the first hospital was built here in 1918, nobody knew about Western healthcare systems. So the British built the hospital that became the Central Hospital later, right? For almost 100 years ago. As we progressed towards independence, Nigerians were trained. Lots of parents went abroad, became the first set of doctors were now trained. When they came back, what type of healthcare system did they come into? It was one that had been designed by the British. If you cast your mind back to the early 60s, 70s, how many doctors were there? Where else could they practice if not government hospitals? So the healthcare system was built around government. And as you progress towards the 70s, with oil boom, yes, government now expanded investments in the healthcare industry. But as you went towards the 80s and 90s, a lot more private investment began to go into healthcare, and began to change the outlook of the healthcare industry. At this point, I must emphasize that we're talking healthcare, not just doctors, and that the healthcare system is beyond the services offered by doctors. It's a system where the doctors play a very important role. But if the entire system don't work, the doctors will have challenges operating in that system. Today, there is significantly more private investment in the healthcare industry than government. Private providers provide more care than government in the healthcare industry, and the data is there. So, if that is the case, what should be the role of government? Should government still be thinking the way about healthcare the way it thought about healthcare 60 years ago, when it was the key player? That when government had the sole responsibility to operate the healthcare system. Government's role is dual, as a regulator and as an operator. But today, there are more private operators than government as an operator. So what should government be doing? I think we first must agree on that. In Edo, we sat back and said, look, we must rethink healthcare. 6 years ago, we decided on a health improvement program that we felt should be anchored on 4 key pillars. First, our role as government, my principal role as a governor in terms of healthcare is to regulate the healthcare industry. Because I am not the largest provider of care anymore. Even if government were the largest provider, who should regulate the services provided by government? Therefore, how should we organize the healthcare functions within government? What should be the role of the Ministry of Health? Do I, as government, have the capacity to manage hospitals? Should I be managing hospitals? Those are the issues we need to think about, vis-a-vis what it had been. Because if you looked at budget for health up till now, the bulk of the budget is to manage hospitals, a health revolving scheme. But if you look at that spend relative to what is spent on healthcare in the entire state, it is small. So is that the best way to use taxpayers' money? The second role we saw for government is to train the industry to support manpower for the industry. Because you don't expect that the doctors themselves are now going to produce all the doctors they need for their use, or the nurses. Government's role is to make sure that you produce quality manpower for the industry. How do we do that? Within the structures of the Ministry of Health. The other role, and what we thought was most fundamental to the healthcare industry, was healthcare financing. Because we realized that people were not going into our hospitals or facilities because they just couldn't afford to pay. And it's only in Nigeria where people buy houses with cash. They go pay for healthcare out of pocket. Everywhere else, you have savings programs that help people afford whether it's housing or healthcare. And we just felt, for us to make progress, let us just stop pretending about a national health scheme and institute our own. And we came up with our own laws. We are also looking at what should be our role as government. For us, our emphasis is primary care, because that is the first point of contact with the healthcare system. So every community, every citizen should not have to trek or drive beyond 5 kilometers before you reach a healthcare center or services. At least basic. And the thinking is, must it all be government alone? Why can't we have private primary healthcare centers? But what links it all together is that all of these centers are pooled together and linked into a government central portal, so that we know when a citizen goes to a center to get care, we can see the records. We have trained trained nurses and doctors who will attend to and collect medical records from these people. We believe that government cannot afford to run the number of secondary care centers or facilities that will give the coverage we require. In any case, many of you are already providing secondary care. Why can't we encourage you to get more investments? Since I became governor in Edo State, at least we've seen not less than 10 high-end, high-quality hospitals coming to Edo State with average investments of nothing less than $10 million each. So why should I be anxious about competing with those people? Why can't we encourage them to have space? Why can't we feed them from referrals from our primary healthcare center? As long as the healthcare financing is there, why can't they pay for it? So what we are saying is that we need a radical rethink from where we are coming from. The era of general hospital is gone. There's no reason why the government hospital cannot and should not compete effectively with a private hospital. There's really no reason. You are treating the same human beings. The health insurance is going to pay for both of them, right? So for the government hospital, you'll always be cheaper because you are not paying rent. We are paying the salaries of the doctors. Consultants in Edo State earn twice what I earn as a governor, officially. Yes, they are consultants, and I'll show you. I have consultants that earn in excess of ₦1 million a month. It's there, we can publish it. I don't earn ₦1 million a month officially. Doctors do here. But that is not what we're talking about here. We're saying that our hospitals should provide the highest quality of manpower, and we should be able to therefore compete effectively with any other provider. As government, we've commenced a reform process. And the key elements of the reform process have started working. For us to first ensure that we lay the foundation of the healthcare system right.
Obaseki Kwansi talk say, for the aspect of quack doctors, they need to retrain health workers and say health na business, and they need to take over from Warri as best health place because they don't want our technology join their own. That make them don't connect fiber around schools and the state. And say Stella Obasanjo Hospital go ready by March, and as state governor, he no go gree make them run the hospital fully sake of say government no sabi run business, as them they look for private partners, and say Edo government not be the main provider of healthcare for the state again.
The primary healthcare system, which is the foundation, is solid and right. Because that will be the source from which we refer patients to for secondary care. And if we get primary care right, then it will significantly reduce our investments in in secondary healthcare. The second is, like I said, we have cracked the issue of healthcare financing. So unlike before, where everybody relied on the government's health budget to drive healthcare, now we have much more money available than what is being provided by government from their budgets for healthcare. It's how do we now utilize and leverage on that to allocate funding efficiently for the entire system. Thirdly, capacity. You talked about quackery. The quackery exists because we encourage it to. Because ideally, nobody should be able to open any practice, open any facility at any level, whether it's a patent medicine store, whatever it is, without the requisite approvals to do so. But if the bulk of the budget that comes to government healthcare is being struggled for by doctors who want to do drug and all the other thing in hospitals, where will we have money to pay people who will now do regulation? So our emphasis must now shift from taking the little money we have to managing and running hospitals that can be done almost on a commercial basis now, to putting money into regulation, to making sure that we're policing the space, that people who shouldn't be who shouldn't be in that space are not there. That way, working with NMA, we will kill quackery in a few months. We need a strong regulatory function in government supported by you, because you know people what's going on. You see sometimes the cases referred to you, to your hospitals. You should tell us, where are those cases coming from? Who tampered with them in the first place? We cannot curb quackery without you. You cannot curb quackery without us. We need that very close collaboration. We also need to agree, like we did last week with the large farmers. You will continue to need manpower. There's nothing you can do about migration. People will move, right? But we have it. That's why we're focusing on education. We're training our children, getting them to learn well at a very early age. Under the Edo Best program today, we're tracking about 300,000 children. I'll be able to give you their performance over a 5-year period. I can easily tell you how many of them are likely to be first-grade doctors in the next 10 years. So our role as government is to continue to invest, working with you, strengthening our training institutions, and see how we can continue to feed our training institutions with a pipeline of quality students. Don't just say, oh, our own business is to get finished products. Be interested in how we arrive at those finished products. Because somebody was interested in you, that's why you are doctors today. And let's not, you know how long it takes to train a doctor or a nurse. These are term investments that only government should make and government must make. How do we collaborate together in training the kind of manpower we need? Between yourselves, what is the level of collaboration? Is healthcare not business? So how do we make it real business and worth your while? What other, doctors are not great businessmen. So how do we help you? How do we support you to have successful practices? You remember at one point, Warri had quite a lot of successful clinics at one point in our history. Remember? Maybe it was the presence of Shell that made it happen. We want to take that business from Warri and make sure that and the reason why we will is that we are going to use technology. We have fiber optics across the state. In most of your institutions, there's fiber running on the streets in front, which means that with technology, if you just use a lot more technology, you'll be connected to what's going on in the whole medical world.
From Benin City, Aberuswagene Ejo, TMC TV News.